So we are a federally qualified health center, and for our scope it is South Naknek and King Salmon. However, if anybody comes to us from somewhere outside of Naknek, we'll see them. As long as they're here, we'll see them. This is the lobby. We have 3 exam rooms. So exam room 1, exam room 2, and exam room 3. We have a small x-ray room. This is where we do our COVID in-clinic testing. And then our Abbott machine is in there in a specialized hood. And then our 2-bed ER. And that's our little clinic. So the population in Bristol Bay Borough as a whole is very fluid. So in the summertime, at fishing, we go from a community of about 800 to 10 to 13,000. It's a melting pot of anyone coming from any country. Last year we recorded 22 different countries of people that came to our clinic. COVID in itself affected who came in and when. So community spread, I believe the reason it's not here is 100% attributed to the way the processors took this serious. They closed their campus, they made it so that their fishermen had a time to come in, and they were quarantining differently than what is mandated by the state for their processors. So we knew early on that working with the seafood processors and knowing what their plans were going to be, were going to directly impact how we were going to see people. First week of March, I sat down with my staff and I said, we need to know what this is going to look like. What do we need to start working on? But the first idea was we needed some place to put sick people. We started an isolation unit. So our isolation units are actually fully contained bedrooms, kitchens, living room, dining room, all in one unit. We have 19 beds total. So this one will hold 8. As we put people in here, we put it in clean. That's why they're not made up before. Full living setup. Unless you would figure somebody that you knew would probably be here for a longer time frame. So I have a dining room set coming for here. And then this is the rec room. And then right here, communal bathroom. So we bought a standalone clinic in a can, and it's 100% outfitted as an ER. I think every village community should have one of these. And here is our little ER. It's under 10,000 pounds, so most smaller forklifts can move it. If there's an outbreak in one of the canneries, take it down there so we're not contaminating the rest of the clinic or anything else. So for testing, we have 2 processes. One is we go out to the plants themselves and work with their providers and swab. Then we also have our walk-in testing site. Back here is where we ask people, we have a table and everything that we put out, and we have people sign up there and fill out their paperwork. And then they walk to the front, and that's where they do the actual testing. So this is our machine here, and so when they get their tests, they pass them through this window, so this way it keeps it all contained in one area.
People who are getting tested actually never enter. We have our swabbing station outside. We take our tests, we do pass them through the window, and they are processed on this machine here. This is called a Cepheid, and this allows us to do same-day testing for COVID samples. It's just a little plastic pipette. This goes into the cartridge, and then the cartridge is simply shut and it's put into the machine like that. And then we close the magic door and off it goes. It takes about 52 minutes. We can do 16 at a time.
So our COVID case count currently, I believe we're right at about 54 confirmed positives. Every one of them have been in the seafood industry. Total COVID tests that we've done were 7,800. I do believe if we start seeing community spread that there will be stricter quarantine mandates within the community, but at this point, because we've been able to contain it, I think there hasn't been a need for it yet. The only thing we want is to protect the community, 100% protect the community.